Hey, ladies. Today we are talking specifically about estrogen. So, we are learning all about hormones, testosterone, estrogen, and progesterone. And today we're going to do a little deep dive into what estrogen is, the function in your body, what estrogen dominance looks like, what low estrogen looks like, the symptoms of each. Causes, and then some things that you can do to naturally either increase your estrogen or lower your estrogen if it's high. And then also throughout this conversation, this discussion, I hope that this will maybe debunk some of those preconceived notions you have about estrogen, because many people think that estrogen is bad, and it's not. It's good, and it has a lot of good functions. But the issue becomes the balance of estrogen and progesterone, and then how you metabolize and detoxify estrogen, which many people don't know that that's a thing, including myself, until I started learning about it. So we'll dive right in. Your body makes three types of estrogen: estradiol, estrone, and estriol. And estradiol is the most potent of all three of these because 95% of it is produced by your follicle in the follicular stages of your menstrual cycle. So at the beginning of your menstrual cycle, 95% of your estrogen is produced in the form of estradiol. And then estrone is the one that tends to get a bad rap because it has the propensity to cause growth in both breast tissue and the uterus. So this is the one that, when people speak of cancers and different types of things that they're referring to. And even if you've had your ovaries removed, you actually still make estrone because it is mostly made in the control of the adrenal glands by way of DHEA, which is a precursor hormone to testosterone and estrogen. So, and then estriol is the third one. This is not produced in great quantity unless you're pregnant. It's a metabolical byproduct. So it's made because of another reaction. But like I said, the issue with these is the balance of these three and the balance of estrogen and progesterone. But let's talk about the good things about estrogen. So estrogen is protective against heart disease, which is really good. So actually, women are far better protected from heart disease than men up until menopause. And this is because as most women know, when you start going through menopause, your estrogen starts to decline rapidly and significantly. So, estrogen also helps keep our bones strong, and it helps regulate cholesterol. It protects your brain. It also contributes to the production of collagen. So, if you're wondering, why you're getting wrinkles, and then why we get wrinkles as we age, that's part of it, right? Because our estrogen is decreasing, and estrogen helps with producing collagen. So this may be a great thing for you to start supplementing with. It is also a precursor to serotonin, dopamine, and noradrenaline. And these are neurotransmitters actually produced in your gut, and they're responsible for keeping you calm, happy, and feeling satisfied. But the thing is most of the data that we have on estrogen today, when people assume that estrogen is bad, it's based on data from synthetic estrogens, which are not the same. So let's talk a little bit about the flux, the ebb and flow of estrogen in a woman's body. So during your cycle, so day 1 is the first day you bleed. So that's day 1 of your menstrual cycle, okay? So from about day 4 to 14, estrogen's climbing. It peaks around day 14, okay? And this may fluctuate a day or two for each woman depending on how long your cycle is. And if you're perimenopausal, if you're menopause or postmenopause, obviously that's going to be different for you. So it goes up and then around day 8, it comes down. So it goes up like a roller coaster and down. And then around day 18, it goes back up again. It comes down around day 18 and then goes back up at day 24. So it looks like this. So it goes up, down, up, and then when you start your period, all of your hormones level out, right? So what is happening there is the brain is signaling to grow a follicle, and then that egg, steps up to bat, says, hey, yes, I'm going to take one for the team. And then if that egg doesn't get fertilized, so you have mid-cycle progesterone. So progesterone comes in there in the middle of your cycle to get you ready for pregnancy. And then if the pregnancy doesn't happen, then all the hormones fall at the same time. And then, so it goes up and comes down, goes up and comes down. So that's why, like, if you've had labs, just like regular blood draw of your estrogen, depending on what type of, what time of the month it is, where you're at in your cycle, your levels could vary wildly. So you do need to make sure that, your doctor is aware of where you're at in your cycle and is taking this into account, and then that does also make it really difficult. So a lot of people may ask, well, what's normal? Where should it be? Well, it depends. Could you see how that normal range could vary wildly between person to person, because it goes up and down and up and down, and depending on the length of your cycle and other lifestyle factors, stress, it can really make those numbers look a lot different. So with perimenopause, you may be missing periods and or have longer periods, right? So your menstrual cycle maybe is 30 to 40 days. And then perimenopause, ladies, can start as early as 35, 37 years old, and it can last for months up until years until you hit menopause, and it can't be prevented. So, it does happen. It is natural. So that's a little bit of the good that estrogen does. So let's talk about estrogen dominance, because this is probably more common than low estrogen. But so estrogen dominance is when you have more estrogen than progesterone, okay? And some of these symptoms, pay attention to these symptoms. Some of these symptoms include heavy bleeding, anxiety, insomnia, heart palpitations, and migraines. And then elevated estrogen can also inhibit thyroid function. So it does this by increasing another hormone called SHBG, and SHBG binds to hormones and it makes them unavailable. So where you've got these hormones that are going to the right places, when SHBG is attaches to them, they can't go where they needed to go. So it makes it unavailable. So it does that with your thyroid. So I won't get off on that rabbit trail. But so the issue is the ratio, right, of the estrogen, progesterone, and then the metabolism of estrogen, which I mentioned earlier. So estrogen has to be detoxified and removed. So I know, most people are familiar with toxins, and yes, we need to remove toxins, right? Our liver does that, but estrogen is also one of those things that needs to be detoxified and removed. And your gut actually plays a huge role. It's actually, there's a term, it's called the estrobolome, and this plays a critical role in your estrogen balance. So if your gut is unhealthy, if you have SIBO or any type of gut disruption, your gut is damaged, then estrogen gets recirculated in a toxic form, and that's not good. So one way you can kind of combat this, which we'll talk about in a second, is having a diet that's full of high fiber, and I'm talking high fiber fruits and vegetables, nuts and seeds, no sugar. I'm not talking about Miralax and laxatives. Those are not good for your digestive system, for your gut. but real fiber from food is. And then staying away from those unhealthy inflammatory fats like the seed oils. So those will help your gut microbiome get in a healthier position. And then when you have estrogen dominance, high estrogen can also increase weight gain because it also can block progesterone, which leads to fertility issues. So if you're in your fertile years, you're trying to have babies, this might be something to look at if you're having a hard time. It can lead to miscarriage, mood disorders, and sleep issues. So, and then when you aren't sleeping, right, the lack of sleep, and we've talked about this before, you're not able to detox hormones such as estrogen, because part of our sleep system, like what we do in our sleep, is we clean up and get rid of dead and damaged cells and toxins. So, and then the more fat you have, you've got to remember, so fat aromatizes testosterone. So you're making testosterone, but the more fat you have, the more it's going to take your testosterone and turn it into estrogen, further exacerbating the estrogen dominant situation. So excess fat causes excess estrogen, and estrogen promotes fat storage. And it promotes fat storage in the breasts, hips, butt, and legs. But good news, it does not promote fat storage in your abdominal visceral fat. So that's good news. But it does everywhere else. So if you carry your weight, if you're pear-shaped, and this is something pretty common, like if you have, a small waist, flat stomach, but you carry all your weight in your butt and your thighs, you may have estrogen dominance. So causes of estrogen dominance are things like obesity, sudden and excess weight gain, low testosterone, using products that actually contain lavender and tea tree oil in studies has been shown to increase estrogen. Xenoestrogens, so these are things like BPAs, phthalates, PUFAs, sulfates, things found in plastics, household chemicals, and then personal care products. And we'll talk a little bit about that in more detail in a minute. Excess alcohol consumption. So if you're drinking a lot, remember alcohol aromatizes testosterone into estrogen just like fat does. Certain medications increase estrogen, such as diuretics, statins. So if you're on a statin for cholesterol, antidepressants, which is very common, NSAIDs, so the non-steroidal anti-inflammatory drugs, contraceptives, kidney disease, liver damage, cirrhosis of the liver. These are all things that will increase estrogen. And why is, you see, the liver and kidney, those are our detox organs. They help filter and detox the things that come in our body. So if those aren't working right, then you're not clearing out estrogen right. So you've got to remember that. So how do we lower estrogen dominance? So like I said earlier, with food, but moderate weight loss. So we don't want to go on any crash diets. So increasing physical activity by way of like resistance training. Like I said, increasing fiber intake, eating cruciferous vegetables, and those include Brussels sprouts, cauliflower, broccoli, cabbage, things like that. Reducing your alcohol consumption, and then avoiding the xenoestrogens and the endocrine disrupting chemicals. So let me talk a little bit more about those few things. So ladies, some places you're going to want to look for these are going to be things that you use every day, like lotion that you're slathering all over your body, your body wash, your shampoo and conditioner, your makeup, your hand soap, your dish soap, your cleaning supplies, your laundry detergent, your fragrance, so your perfume. And then obviously a lot of times we can't really do anything about the air we breathe, but if you can get an air filter for the inside of your house, that will help. And a water filter. So if you can afford any type of water filter is better than none. But these are all your plastic containers, the food, like even, saran wrap, Ziploc baggies. Like these are all things that need to be considered, because plastic water bottles, like they leach those endocrine disrupting chemicals into our food and they go into our body. So keep those things in mind as you maybe take a look around your house and think like, what are some things I can do without or swap out? Nail polish is a big one. That's a big change that I made this year. I stopped painting my nails. There are clean products out there that you can try, obviously, and there's clean makeup products. I use Ilia, Ilia for my makeup, and I use all clean household products now, and I switched to glass containers. So it's a process. You don't have to go out and do all of that today. But so that's estrogen dominance. And then likewise, low estrogen is the thing. So I have low estrogen, and I know why, but low estrogen can also result in weight gain. And it also increases your risk of injuries. Why? Remember, because it contributes to the production of collagen. It increases your likelihood or worsens arthritis and cardiovascular disease. So low estrogen. And then low estrogen obviously is very common after menopause due to the natural decline of progesterone and estrogen. So ladies, you start losing progesterone, your progesterone starts to decline around 37 years old, and then it just continues to decline. Testosterone starts to decline when you turn 30, and then estrogen can start to decline at different points of women's lives, but typically perimenopause and then definitely in menopause. And this is why so many women struggle with weight gain. But the causes of low estrogen, let's talk about that because this could be you. Chronic low calorie diets, so not eating enough. If you've had eating disorders, anorexia, where you've been malnourished, chronic strenuous exercise, that was mine. And then chronic stress. So my two that drove my estrogen in the toilet were chronic exercise and chronic stress, and I did a chronic low carb diet for years. And I still eat low carb, but I do that because of my genetics and because type 2 diabetes runs rampant in my family. So I just had to adjust, make changes in my stress, and make changes with the way I exercise, which I've done. So insulin resistance, thyroid dysfunction, so hypothyroidism, pituitary gland dysfunction, autoimmune conditions, kidney disease, removal of your ovaries, because your ovaries are responsible for producing a good amount of estrogen. And then polycystic ovarian syndrome, aging, and perimenopause. And like I said, ladies, there's nothing you can do about menopause. It's gonna happen. It is natural, but the symptoms you experience during menopause can be probably made a lot better. Not probably, I know they can. So ways to raise your estrogen levels naturally are things like consuming nuts and seeds like sesame seeds and flax seeds, making sure your vitamin D levels are in optimal range, consuming foods with B vitamins like beef, chicken. B vitamins are very important, and you can get most of those from meat. Supplementing with things such as some good things are red clover, chasteberry, black cohosh, dong quai, boron, and inositol. And by the way, you should not go out and buy any of these until you've made sure that you have a low estrogen issue. And then obviously maintaining a healthy body weight. You don't want to be so lean. That was something that I encountered. It was I didn't have enough body fat. So that contributed, right? Because my over-exercising. But, so don't go run out and buy any of these supplements. So to wrap this up, could you go by these symptoms and try some of these natural things? Yes, of course, because you'll get healthier by doing any of the things I've suggested today. But, estrogen, your hormone levels are not something you want to typically go guess at and put your self-medicate. This is something you need to get labs for. So I would recommend the Dutch test complete because this checks at you have to take the test on a certain day of your cycle. So you take it at home. It's a urine sample. You get 3 samples of your urine at different times of day. It checks your stress and then your estrogen, your testosterone, your pathways, how you're detoxifying, how you're methylating. So you can get one of these tests from a functional practitioner. So I hope this was helpful. We still have yet to discuss progesterone, so that will be the next topic of conversation.